Hello, friends, and welcome back to your most trusted source for Social Security updates. There are two absolutely critical dates coming up in October 2025 that every senior needs to mark on their calendar right now. These dates will directly impact your Social Security benefits, Medicare coverage, and your financial planning for 2026. Missing either of these dates could cost you money or leave you with inadequate healthcare coverage. So stay with me as I explain exactly what's happening and what you need to do. October is shaping up to be one of the most important months of the year for American seniors, and I want to make sure you're prepared for both of these crucial dates that are coming up. The first critical date is October 10th, which is when the Social Security Administration is expected to announce the official cost of living adjustment for 2026. This COLA announcement will tell you exactly how much your Social Security retirement benefits, SSDI payments, and SSDI benefits will increase starting in January 2026. The second absolutely essential date is October 15th, which marks the beginning of Medicare open enrollment, a window that runs through December 7th and gives you the opportunity to make changes to your Medicare coverage for next year. Both of these dates require your attention and action, so let me break down everything you need to know about each one. Starting with the COLA announcement expected around October 10th, this is the moment millions of seniors have been waiting for throughout 2025. The cost of living adjustment is the annual increase that Social Security provides to help your benefits keep pace with inflation and rising costs. Based on the latest projections from trusted organizations like the Senior Citizens League, early estimates suggest the 2026 COLA could be around 2.7 to 2.8%, which would translate to approximately 54 to 58 additional dollars per month for the average Social Security beneficiary. While this might not sound like a massive increase, it represents real money that can help cover rising costs of groceries, utilities, prescriptions, and other essential expenses that you face every month. The way the Social Security Administration calculates the COLA is based on something called the Consumer Price Index for urban wage earners and clerical workers, which is quite a mouthful, so most people just call it the CPI-W. This index measures changes in the prices of goods and services that typical workers purchase, including food, housing, transportation, medical care, and other necessities. The Social Security Administration compares the average CPI-W from the third quarter of this year, which includes July, August, and September, with the same period from the previous year. If prices have gone up, which they typically have, then Social Security benefits increase by that same percentage to help maintain your purchasing power. What makes this October 10th announcement so important is that it gives you advance notice about what your monthly benefit will look like starting in January 2026. This information is crucial for your financial planning because it allows you to create a realistic budget for next year, knowing exactly how much income you can expect from Social Security. If you receive Social Security retirement benefits and your current monthly amount is around $2,008, which is roughly the national average, then a 2.7% COLA would increase your benefit to about $2,062 per month. For couples who both receive Social Security, these increases compound, providing even more significant additional income to help manage household expenses. For those of you receiving supplemental security income, the COLA announcement is equally important because SSI benefits also receive the same percentage increase. SSI recipients often rely entirely on these monthly payments for their basic needs, making every dollar of increase critically important. The maximum federal SSI payment for an individual in 2025 is $943 per month, so a 2.7% increase would bring that up to approximately $968. While SSI recipients face unique challenges due to the lower benefit amounts, the consistent COLA adjustments help ensure that your purchasing power doesn't erode completely as prices rise over time. Social Security disability insurance beneficiaries should also pay close attention to the October 10th COLA announcement because your monthly SSDI benefits will increase by the same percentage. SSDI recipients often have limited ability to supplement their income through work due to their disabilities, making these annual increases particularly valuable for maintaining financial stability. The average SSDI benefit in 2025 is approximately $1,537 per month, so a 2.7% COLA would add about $41 to that monthly amount. I encourage you to share in the comments below how you plan to use your COLA increase and whether you feel these adjustments adequately reflect the rising costs you're experiencing in your daily life. Now, let me shift to the second critical date you absolutely cannot miss, and that's October 15th, which marks the start of Medicare open enrollment. This enrollment period runs from October 15th through December 7th, giving you almost 2 full months to review your current Medicare coverage and make changes if needed for 2026. Medicare open enrollment is the one time each year when you can switch from original Medicare to a Medicare Advantage plan, change from one Medicare Advantage plan to another, switch back from Medicare Advantage to original Medicare, join a Medicare Part D prescription drug plan, or change your existing Part D coverage. Understanding these options and taking action during this window is absolutely essential because the choices you make now will affect your healthcare coverage for the entire year of 2026. The reason October 15th is so critical is that outside of this enrollment period, you generally cannot make changes to your Medicare coverage unless you qualify for a special enrollment period due to specific circumstances, like moving to a new service area or losing other health coverage. Medicare open enrollment from October 15th to December 7 gives people with Medicare the opportunity to make unrestricted changes to their Medicare coverage for 2026, and any changes you make during this time will take effect on January 1st, 2026. Missing this window could mean you're stuck with a plan that doesn't meet your needs, doesn't cover your doctors, includes medications you don't take while excluding ones you do need, or costs more than necessary for the coverage you actually use. One of the most important things to understand about Medicare open enrollment is that insurance companies make changes to their plans every single year, and these changes can significantly impact your out-of-pocket costs and access to care. Plan premiums can increase or decrease, the list of covered prescription drugs can change, co-payments for doctor visits and hospital stays might be adjusted, and the network of doctors and hospitals included in Medicare Advantage plans can expand or contract. Even if you are completely satisfied with your Medicare coverage in 2025, you absolutely must review your options for 2026 because what worked perfectly last year might not be the best choice anymore due to these annual plan changes. The timing of these two critical October dates is actually quite strategic and can work to your advantage if you use the information wisely. When the Social Security Administration announces the 2026 COLA around October 10th, you'll also learn about any changes to Medicare Part B premiums for next year. Medicare Part B premiums are automatically deducted from your Social Security benefit before you receive your monthly payment. So understanding both the COLA increase and the Part B premium change allows you to calculate your actual net benefit increase. For example, if your Social Security benefit increases by $54 due to the COLA, but your Medicare Part B premium increases by $10, your actual take-home increase would be $44 per month. Having this information early in the Medicare open enrollment period gives you the opportunity to shop for more cost-effective Medicare coverage if you determine that rising premiums are eating up too much of your COLA increase. For veterans who receive both VA benefits and Social Security, these October dates carry additional significance because VA compensation and pension benefits often follow similar timing patterns for their own annual increases. While the VA typically announces their COLA separately from Social Security, the increases are usually identical in percentage, meaning veterans can expect their VA disability compensation and pension payments to rise by the same amount as Social Security benefits. Additionally, veterans enrolled in VA healthcare should still pay attention to Medicare open enrollment, especially if you use Medicare as your primary insurance or if you're considering coordinating your VA healthcare benefits with Medicare coverage for more comprehensive access to providers and services. Let me provide some practical guidance on how to prepare for both of these critical October dates so you can make the most informed decisions possible. For the COLA announcement expected around October 10th, I recommend that you log into your My Social Security account at ssa.gov before the announcement is made to verify your current benefit amount and ensure your contact information is up to date. This way, when the new COLA percentage is announced, you can immediately calculate what your new monthly benefit will be starting in January 2026. The Social Security Administration will also send you a notice in the mail, typically in December, showing your exact new benefit amount. But having the information early allows you to plan ahead rather than waiting until the last minute. For Medicare open enrollment beginning October 15th, your preparation should start even earlier. Review all the mail you receive from Medicare and your current insurance plans in late September and early October, because these mailings contain crucial information about changes to your 2026 coverage. Look specifically for your annual Notice of Change, which every Medicare Advantage and Part D plan is required to send you by September 30th, explaining what's different about your plan for the upcoming year. Also watch for your Evidence of Coverage document, which provides detailed information about what your plan covers, how much you'll pay, and which providers and pharmacies are in your plan's network. Reading these documents carefully before October 15th ensures you're ready to compare plans and make informed decisions as soon as the enrollment period opens. When comparing Medicare plans during open enrollment, focus on your specific healthcare needs rather than just looking at the monthly premium. Consider which doctors and specialists you see regularly and verify they're in the plan's network. Review the plan's formulary to confirm your prescription medications are covered and determine what tier they're placed in because this affects your copayments. Calculate your total expected out-of-pocket costs by adding up premiums, deductibles, copayments, and coinsurance based on your typical healthcare usage. And check whether the plan includes extra benefits like dental, vision, hearing, or fitness programs that might be valuable to you. The Medicare Plan Finder tool on Medicare.gov is incredibly helpful for comparing plans side by side and estimating your annual costs based on your doctors and medications. One common mistake that many seniors make during Medicare open enrollment is assuming that because they were happy with their current plan, they don't need to review their options for the next year. Unfortunately, this assumption can be costly because insurance companies frequently make significant changes to their plans between years. A plan that had low copayments for your medications in 2025 might increase those costs substantially in 2026. Or a plan that included your favorite doctors in its network might drop some providers, leaving you with out-of-network charges or forcing you to find new healthcare providers. Taking the time to review your options every single year during the October 15th through December 7th enrollment period protects you from unexpected costs and coverage gaps. The interaction between your Social Security COLA increase and your Medicare costs is something that deserves careful consideration during this October planning period. Every year, there's a provision called the Medicare Hold Harmless Rule that protects most Social Security beneficiaries from having their Part B premium increase exceed their COLA increase. This means that if you're already receiving Social Security benefits and having your Medicare Part B premium deducted from your check, your premium generally cannot increase by more than your COLA, ensuring that your Social Security benefit never decreases from one year to the next. However, this protection doesn't apply to everyone, particularly those who are new to Medicare, those who don't have their premiums deducted from Social Security, or those who pay higher premiums due to income-related adjustments. So understanding how this rule affects your specific situation is important. For those of you dealing with income-related monthly adjustment amounts, which is often abbreviated as IRMA, the October planning period is especially important. IRMA is an additional charge that higher-income Medicare beneficiaries pay on top of their standard Part B and Part D premiums. And these amounts are recalculated annually based on your income from 2 years prior. If your income has decreased significantly due to retirement, death of a spouse, or other life-changing events, you may be able to request a reduction in your IRMA by filing Form SSA 44 with the Social Security Administration. Addressing these issues during the October to December timeframe ensures that your Medicare costs are as accurate as possible for 2026. I want to emphasize the importance of getting help if you feel overwhelmed by any of these decisions or deadlines. The State Health Insurance Assistance Program, which is called SHIP, provides free, unbiased counseling to Medicare beneficiaries in every state. SHIP counselors can help you understand your Medicare options, compare plans based on your specific needs, and enroll in coverage during the October 15th through December 7th open enrollment period. You can find your local SHIP program by calling 1-800-MEDICARE or visiting shiphelp.org. Additionally, if you need assistance understanding your Social Security benefits or calculating your new amount after the COLA announcement, you can contact the Social Security Administration directly at 1-800-772-1213 or visit your local Social Security office, although be aware that wait times can be long, especially during peak periods. The combination of these two critical October dates represents an opportunity for you to take control of your financial and healthcare future. By paying attention to the COLA announcement around October 10th, you gain clarity about your income expectations for 2026, allowing you to budget more effectively and make informed decisions about your spending and saving. By actively participating in Medicare open enrollment starting October 15th, you ensure that your healthcare coverage aligns with your healthcare coverage and financial constraints, potentially saving hundreds or even thousands of dollars in out-of-pocket costs throughout the year. These aren't passive events that happen to you. They're opportunities for you to make active choices that improve your quality of life and financial security. If you found this information helpful and you don't want to miss important updates about the actual COLA percentage when it's announced, or details about the best Medicare plan options for 2026, please make sure to subscribe to this channel and click the notification bell so you'll be alerted the moment I post new videos with that critical information. I'll be closely monitoring both of these situations and providing you with comprehensive coverage as soon as the official announcements are made. Also, take a moment to like this video if you appreciate having all this information explained clearly in one place, and please share it with your friends and family members who might be confused about these important October deadlines. Let me summarize the two critical Social Security dates you absolutely cannot miss this October 2025. First, around October 10th, the Social Security Administration will announce the official cost of living adjustment for 2026, which is currently projected to be approximately 2.7 to 2.8%, representing about $54 to $58 additional dollars per month for the average Social Security beneficiary. This increase will affect Social Security retirement benefits, SSI payments, SSDI benefits, and VA compensation, giving you advance notice to plan your 2026 budget effectively. Second, October 15th marks the beginning of Medicare open enrollment, which runs through December 7th and is your only opportunity to make unrestricted changes to your Medicare Advantage, Part D prescription drug coverage, or switch between Original Medicare and Medicare Advantage plans for 2026. Your action steps for these critical October dates should include the following. Log into your My Social Security account at ssa.gov to verify your current benefit information and prepare to calculate your new amount once the COLA is announced. Watch for mail from Medicare and your current insurance plans arriving in late September and early October, specifically your annual notice of change and evidence of coverage documents. Set aside time between October 15th and December 7th to carefully review your Medicare options using the Medicare Plan Finder at medicare.gov or with assistance from your local SHIP program. Contact the Social Security Administration at 1-800-772-1213 if you have questions about your benefits or need help understanding how the COLA affects your specific situation. For veterans, also verify your information with the VA to ensure you receive coordinated benefit increases and understand how your VA healthcare coordinates with Medicare. Mark your calendar right now for October 10th and October 15th, because these dates will have a direct impact on your income and healthcare coverage for the entire year of 2026. The decisions you make and the attention you pay during this October window will affect your financial security and access to medical care for the next 12 months, so treat these dates with the importance they deserve. Remember that you've worked hard throughout your life and paid into these programs, and you deserve to maximize every benefit and opportunity available to you. Stay informed, stay engaged, and don't hesitate to ask for help when you need it. Until next time, take care of yourselves, and I'll see you in the next update with the actual COLA announcement and Medicare plan comparisons.